We thrive!
We thrive!
We thrive!
We thrive!
In Hamilton County, we thrive. In 2010, Hamilton County Public Health received a grant from the Centers for Disease Control and Prevention to fight obesity and chronic diseases. In Hamilton County, 1/3 of third graders are obese or overweight. More than 64% of adults do not get enough physical activity. Hamilton County Public Health began working with schools, communities, and local organizations to create the We Thrive movement.
Chronic diseases are the leading causes of death in our society today.
This is unacceptable, and we know how to make the difference in Hamilton County.
It's about truly about making the healthy choice the easier choice.
To improve the health of our children, schools became a priority for the We Thrive movement. Hamilton County Public Health partnered with the Center for Closing the Health Gap and the Nutrition Council to address health in schools.
We began a multi-pronged social marketing campaign that included billboards, that included radio conversations, posters, community presentations, being present in work sites and churches to be able to help raise awareness that we were in a crisis in Hamilton County, that we might be raising the first generation of kids who would live sicker and shorter lives than their parents.
When Cincinnati Public Schools was presented an opportunity to partner with We Thrive, we took advantage of that opportunity immediately. We knew it was going to be an investment in not only our students, but an investment in our community. There's multiple studies that show that nutrition is linked directly to learning. So we believe it's important for us to educate the whole student, and that means also good nutrition and good physical education. Prior to our partnership with We Thrive, many of our schools had vending machines that were actually distributing out high-fat, salty, sugary, both drinks and also snack items. We were able to remove those vending machines from our schools. We know if we offer them the healthy selections, they come.
I think it's been great this year working with We Thrive. It's a great organization that's really getting the message out there to community members as well as different school officials that it is important to have healthy school meals and healthy choices for our students. This year our changes have been more fresh fruit and vegetables, they've been whole grain items, less sugary sweet items, and lower in fat and saturated fat than in previous years.
It's been proven that if kids get about 15 to 20 minutes of exercise in the morning, that they actually do better academically.
Many children in Hamilton County live close enough to walk to school, but are driven or ride the bus because families feel that the streets are not safe. We Thrive helps communities participate in programs that support a safer environment for school children, such as Safe Routes to School.
The Safe Routes to School program is facilitated through the Department of Transportation, and the program is designed to encourage kids to either walk or ride their bikes to school, and the program helps to make sure that they can do so safely.
One of our big projects has been a bicycle helmet safety program. We were able to secure some bicycle helmets from Children's Hospital and passed out about 80 helmets in our district. Over a period of 3 weeks, kids that rode their bikes to school and wore their helmets were given a ticket, and at the end of that time we drew names from those tickets, and one child at each building received a bicycle.
I think what we've done is make We Thrive be an everyday activity for our kids, be it through eating a healthy lunch or participating in a physical education activity in our school, and then carrying that through to our after-school programs and our community programs.
Our parents and staff, there are fruit and vegetable bags available for $5.
We Thrive successes in Hamilton County schools go home with school children and extend throughout their communities.
Our kids are our biggest supporters in terms of relaying messages to their parents that we do have healthy food options here.
At South Avondale Elementary School, students eat fresh, healthy food at school, but their neighborhood does not have a grocery store. Healthy meals are hard to come by at home.
Every 2 weeks we come and set up with our bags, and the produce is delivered to South Avondale.
Hamilton County Public Health worked with the Center for Closing the Health Gap to partner with the school in order to provide bags of fresh produce every other week for $5 a piece.
They said they can't go to a grocery store and get that much stuff for $5.
Many times parents may only come to school when something goes wrong. We have more to offer than simply discipline and academics, that we're here for you, we're here to keep your best interest in mind, and we're here to make sure that everyone is provided a safe and affordable opportunity for healthy eating.
People are beginning to eat better. I just think it's making an impact. I think the entire program is making an impact. I wish it could be in every school.
There are more food distribution sites in churches and community centers to reach residents who live in food deserts. WeTHRIVE supports community gardens at churches, parks, schools, and community centers, all increasing access to fresh fruits and vegetables. Hamilton County Public Health worked with the YMCA to create access to safer options for physical activity after school and through the neighborhood YMCAs. The YMCA of Greater Cincinnati implemented a policy that required physical activity in all Cincinnati after-school programs.
We've had great response with the kids. A lot of the kids say that, without the Y and without us being here, they would just be hanging out at home or walking around on the streets.
They also offered subsidized memberships to families in need so that they could join a local Y at a discounted rate.
I know that it's a safe environment for the family to come to, and we can just enjoy ourselves. And I think the YMCA has made it affordable for families in the community. This resource has to be available. It just has to be available so that we can break out of the sedentary lifestyle.
WeTHRIVE communities work to enhance walking trails, skate parks, and playgrounds, or create shared use agreements so all residents, kids, and adults can get physically active in a safe place. Shared use agreements are partnerships between communities and other agencies such as churches, restaurants, or schools that allowed for increased access to physical activity spaces and healthy food options.
And your grandma said you love fruits and vegetables, so that's awesome.
To combat obesity in its infancy, Hamilton County Public Health worked with Children's Hospital to create the WeTHRIVE Hamilton County Obesity Learning Collaborative. The collaborative educates pediatricians in obesity prevention and treatment, especially in the neighborhoods most at risk. The project trains physicians to counsel patients about obesity-related issues in order to help them become healthier.
Childhood obesity is like one of the biggest problems right now in children. As a pediatrician, it's partly a responsibility to get involved with this. WeTHRIVE has helped us do that, and we continue to be involved with WeTHRIVE for that reason, because we want to continue to find ways to connect our patients with the resources in their community.
People overall do want their children to be healthier than they are. It's truly all about making it better for the next generation.
The WeTHRIVE program is a positive initiative that is going to help build healthy lifestyles and an active lifestyle between students, parents, and community members.
I think WeTHRIVE is an excellent opportunity for school districts to really show their kids that this is a way of living. It's not a class, it's not a lunch, it's actually a lifestyle.
WeTHRIVE is helping us, is giving us the framework to address our problems about healthy lifestyle, physical activity, and safe routes to school.
WeTHRIVE brings together community partners, churches, schools, businesses, elected officials, and residents to make changes that support healthy lifestyles for people of all ages.
WeTHRIVE! Thank you, WeTHRIVE!
What can WeTHRIVE do with your community? Thrive with us.